Hey everyone, welcome back to the channel. Today, we're breaking down a serious topic, but don't worry, we're keeping it simple and clear. We're talking about what causes a stroke, and why it's something you should definitely know about. Let's get into it. Strokes are a serious medical condition affecting millions of people worldwide. They occur when blood flow to the brain is disrupted, depriving brain cells of oxygen and nutrients. This can lead to brain damage and potentially life-altering consequences. Understanding the causes, symptoms, and risk factors associated with stroke is crucial for prevention and timely intervention. Strokes are often called brain attacks. Just like a heart attack happens when blood flow to the heart is blocked, a stroke happens when blood flow to a part of the brain is blocked. This blockage can cause brain cells to die, leading to various disabilities. The good news is that many strokes are preventable. By understanding the risk factors and making healthy lifestyle choices, you can significantly reduce your risk of experiencing a stroke. Knowing the warning signs and seeking immediate medical attention can also make a huge difference in the outcome. Imagine your brain as a complex network of roads and highways, with blood vessels acting as the transportation system carrying vital oxygen and nutrients to different areas. A stroke occurs when there's a disruption in this transportation system. There are two main types of strokes, ischemic and hemorrhagic. An ischemic stroke is like a traffic jam in the brain, where a blood clot blocks a blood vessel, restricting blood flow. A hemorrhagic stroke, on the other hand, is like a burst pipe, where a blood vessel ruptures and leaks blood into the surrounding brain tissue. Regardless of the type, a stroke is a medical emergency that requires immediate attention. The longer the brain is deprived of oxygen, the greater the potential for damage. Time lost is brain lost, so recognizing the signs and seeking help quickly is crucial. Ischemic strokes are the most common type, accounting for about 87% of all strokes. They occur when a blood clot forms, often in an artery that's already narrowed by plaque buildup, or atherosclerosis. This clot can completely block the artery, preventing blood flow to the brain tissue it supplies. Hemorrhagic strokes, while less common, are often more deadly. They happen when a weakened blood vessel in the brain ruptures, causing bleeding into the surrounding tissue. This bleeding can put pressure on the brain, damaging brain cells and disrupting normal function. Several factors can increase your risk of both types of strokes. These include high blood pressure, smoking, diabetes, high cholesterol, and a family history of stroke. The good news is that many of these risk factors are controllable through lifestyle modifications and medication. Section 4. Recognizing the signs. Fast action saves lives. Recognizing the signs of a stroke and seeking immediate medical attention is crucial for improving outcomes. Remember the acronym FAST. Face drooping. Does one side of the face droop or feel numb? Ask the person to smile. Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Speech difficulty. Is speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence. Time to call 911? If you observe any of these signs, even if they are temporary, call 911 immediately. Time is of the essence when it comes to stroke treatment. The sooner a stroke is diagnosed and treated, the better the chances of minimizing brain damage and maximizing recovery. Don't hesitate to call 911 if you suspect a stroke, even if the symptoms seem to be improving. Section 5. Prevention and healthy habits. Lowering your risk. While not all strokes are preventable, you can significantly reduce your risk by adopting a healthy lifestyle. Here are some key steps to take. Control your blood pressure. High blood pressure is a major risk factor for stroke. Work with your doctor to manage your blood pressure through lifestyle changes and medication if needed. Quit smoking. Smoking damages blood vessels and increases your risk of blood clots. Quitting smoking is one of the best things you can do for your overall health, including your brain health. Manage diabetes. High blood sugar levels can damage blood vessels over time. Work with your doctor to manage your diabetes through medication, diet, and exercise. In addition to these steps, maintaining a healthy weight, eating a balanced diet, exercising regularly, and limiting alcohol consumption can all contribute to a healthier you and a lower risk of stroke. Remember, prevention is always better than cure. So, to recap, strokes are caused by blocked or burst blood vessels in the brain. They're serious, but many are preventable if you know the risks and live a brain-healthy lifestyle. If you found this helpful, give it a like, Share it with someone who needs to hear it, and don't forget to subscribe for more easy-to-understand health videos. Stay safe and stay smart.